Integration between health and social care will be coming in April 2015. At the moment, we're all unsure of exactly what this will mean for us in our jobs and as part of a community. So let's follow Mrs. Smith as she finds out about integration and how it fits into her life. Mrs. Smith enjoys her weekly visit to the country dancing group, which is run by a group of enthusiastic volunteers. The club allows people like Mrs. Smith to remain active, in touch and engaged with their community. She didn't know it when she first went along, but this is integration. As the group leader explained to her, it's more than just music and dancing. It gets people out of the house and interacting with others, and it keeps you physically active. That's part of what integration is about. Mr. Marr came over to tell Mrs. Smith how pleased he was that after a long period in hospital, his wife was getting home. Previously, they didn't feel there was enough support available. But integration had solved the problem. The senior charge nurse, their GP, home care, social work and the family were now working together, allowing Mrs. Marr to return to the house with a network of support round about her. Coming out of the community centre, Mrs. Smith remembered that she needed to get her annual flu jab. She's a firm believer that prevention is better than cure. At the clinic, she chatted to the nurse about integration and all the good things she'd heard about it. The nurse agreed. Communication was easier now they were working as a single team, but integration also meant that people in the wider community were taking a more active role in looking after each other. Leaving the clinic, Mrs. Smith wondered how people like her fit into this new world of integration. Before going home, she popped in to see her neighbour Bill. He had suffered from depression for many years and she realised that her regular visits were a key part of his support. She had been part of integration without really knowing it. She told him about the idea of a single team and how it might benefit him. She encouraged Bill to take more responsibility for his own care. She admitted that she didn't always feel like going to the country dancing, but she was able to see that it was good for her, so she went anyway. Bill had heard about the men's shed and agreed that he would give it a go. Bill's friend popped in. She's a home carer and seemed to know all about integration. She'd been delighted when her line manager had come to her and asked for her views on how they could work more effectively as part of the single team. A couple of weeks later, Bill dropped round to Mrs. Smith to thank her for giving him a bit of encouragement. A volunteer was now supporting him to go along to the men's shed, and he was feeling more positive about things. He'd also decided to contact his CPN and discuss his changing needs. For Mrs. Smith, what started as a bit of fun at the dancing group turned out to be a real understanding of what integration is all about. It's getting people engaged, it's prevention, it's listening to people and encouraging an active role in your own care. It's about a single team providing more effective support with family, individuals and community groups as key partners.